5 years ago, I was at what should have been the pinnacle of my career. As a consultant paediatrician, I was in a role that I'd been aspiring to since being a child myself. And as clinical lead of a fledgling paediatric department, I was leading a team of healthcare professionals trying to improve healthcare services for the local population we served. A mission became all the more meaningful that when my dad, himself the doctor, died at the hands of substandard medical care. What I didn't realise, and looking back, it sticks in my throat to say it, was that at a deeper level I was failing. As resources were cut, as doctors, nurses, managers were being asked to do more for less, as sickness levels rose, I responded in the only way I knew since childhood, which was working harder, coming in early, leaving late, and neglecting the other things in my life which now came a distant second: my health, my wife, looking after my own kids. What I didn't do was empower my team, and in neglecting this, I became more and more isolated, as I disenfranchised the very team members who I thought it was my duty to serve. Slowly but surely, I became the bogeyman in the department, and what I recognise now as burnt out. Within a year, I couldn't cope, and I resigned not just my clinical lead role, but my job as a consultant. For the first time in my life, I was unemployed and unemployable, and broken, having left the job that I loved. It was during this hiatus in my life, searching for meaning, that I came across a local time bank. Time banking is neatly summarised by give an hour, get one back. So say, for example, your next door neighbour breaks their leg. If you're both in the time bank, you can spend an hour of your time mowing their lawn, and in so doing, earn one time credit that you bank. Now, if at a later date you need help filling in your tax return, you can ask on the time bank, and say someone in the local community has accounting as a background, they can earn that credit from you. And in doing this, three things have been achieved. The first thing is work has been done without paying for it and with relatively little bureaucracy. Secondly, it's connected community members in a way that they would never have done before, and hence build community cohesion. And thirdly, perhaps most surprisingly, is that by giving an hour of your time and being genuinely appreciated for it is incredibly satisfying. And because everyone's time is valued equally, whether you're mowing lawns, babysitting, or carrying out complicated financial transactions, the result is the same. The focus is on not what you can't do, but what you can. Not your deficits, but your assets. And with that comes a real deep sense of well-being. I started seeing the similarities between this deprived but proud community with my own team of healthcare professionals. I was also struggling with complex problems in the face of diminishing resources and mounting bureaucracy. I was also reluctant to seek help from my team or others who may have solved the same problem elsewhere. I was also focusing not on our assets, but my deficits. In my misguided attempts to drag my department out of trouble, I was unwittingly depriving my own team members, and by extension others from across health and social care, from making a difference themselves and benefiting from the gift of giving. I wondered whether a time bank of purpose rather than of place could similarly generate energy and motivate staff to improve the quality of care that we gave. It was then that I was introduced through the Health Foundation through a senior NHS manager, John Lodge. From his vantage point, he was frustrated by huge unwarranted variation in patient outcomes. He saw some organisations really struggling just delivering the basics of patient care, whereas others, better resourced, were exemplars of their service and had spare capacity. All the while, people were falling in the cracks between the patient pathway. What he wanted was a skills exchange platform, something that could move resources, knowledge or expertise to where they were most needed at the time of greatest need. I joke that he's the hard-nosed Telegraph reader and I'm the archetypal Guardian subscriber, so between us we've got the whole political spectrum covered. Together we founded the world's first healthcare professionals time bank, Hexitime, putting people's heads together to improve the quality of healthcare. And although this was a time bank of purpose rather than of place, even in this virtual community, the simple time banking rules remain. No money changes hands, and everyone's time is valued equally, irrespective of pay scale, gender or race. Within a few days of our launch we had 100 members, within 6 months 500, and in a little over a year over 1,000, and we were well on our way to becoming the biggest time bank in the world. Daily, members are posting generous offers and heartfelt requests for help. And whether it's a CEO in an NHS Trust in Scotland receiving a 1-hour tutorial online from an office worker in London, or a paediatric nurse in Walsall receiving help from an expert at a local university, the result is the same. One credit is exchanged, everyone wins and gets more than they put in. I found that in a healthcare industry that struggles to admit its own failings, Hexitime is allowing healthcare professionals to say, I don't know what to do, and then rely on the inherent generosity of colleagues they may never have met to help them in that hour of need. We had discovered the basic building block of a social movement, the preparedness to show vulnerability and to ask for help. Time exchanges are now happening regularly, in just the same way that John and I were brought together to found Hexitime. Our platform is catalysing connections between individuals to improve the quality of healthcare. Our learning has been fast and uplifting. Just as in Timebank's place, we found that offers outnumber requests 5 to 1, a reflection of the kindness this kind of platform kindles. Secondly, if you've ever been to a meeting or a conference where the conversations during the break are more helpful than the lectures, that's because the tacit knowledge of the other delegates helps you transform theory into practice. And Hexitime is generating these coffee table conversations, bringing together colleagues, sometimes from the same organisation, who may never have met. Timebanking is helping productive work to be done and new ventures to be launched, leading to improvements for colleagues and for patients. In a healthcare economy that's moving slowly from competition to collaboration, exchanges between what would once have been rival organisations are moving mindsets and showing the magic that can happen when healthcare enters the sharing economy. Gandhi taught us that the best way of finding yourself is losing yourself in the service of others, and Hexitimers are finding that by giving time away, they are coming away inspired and enthused, generating energy and ideas to improve the quality of healthcare. I wish I'd known this during my first forays into clinical leadership, but I'm discovering now that by giving the gift of giving, everyone gets a lot more back.